Hey guys, in this video I'm going to talk to you more about spasticity and some more weight bearing exercises that you can do. So in the past two videos I've actually talked about spasticity quite a bit, and I've done a bit of on the ankle and on the knee exercises. So if you want, you can go and check this out. The link is in the description below. So in this video I'm going to give you a simple explanation of spasticity. I'm going to give you some warm-up exercises that you can do for your leg for spasticity, and then I'm going to focus on weight bearing exercises, which are the most effective form of exercises that you can do when you have spasticity in your lower limbs. Welcome to Basically Physio. My name is Suresh and I'm a physiotherapist. A quick disclaimer is that none of this replaces medical professional advice, and I do this in my personal capacity. I do not represent anyone. So an analogy that I like to give for spasticity is like a car that is moving and the accelerator and the brake pedals that are inside the car. The car represents your body and the brake and accelerator pedals are part of your brains. So in a normal time, when you do not have any issues, your body is moving well and the car is actually moving fine. It's not in a jerky movement. But what happens after a stroke is that the brain loses its ability to control the brakes a lot more. So that means the braking force is going to be much lesser as compared to the accelerator force. So if you can put it in a perspective of a car, what's going to happen is that when you press the accelerator, the car is just going to go. It's just going to be very excited and go, and there's not much of braking force that's happening because the brain is damaged, right? So what happens when the braking force is much lesser in your body? What happens is that your muscles tend to get excited with a little bit of input, and they tend to remain in a more shortened position because they are much more excited and in an overdrive state. So when they are much more shortened, what happens is that the muscles, when you put them in a very short position, the cells inside, the connective tissue inside, and the skin that surrounds this muscle, everything is going to get tighter. And as everything is tight, what happens is that this muscle tends to become shorter, much more faster compared to a case where you do not have spasticity. And when things are much more short, it is just going to irritate or trigger this spasticity and this hyperexcitation a lot more. And this is what is the vicious cycle of spasticity and shortening of muscles. Because when you have spasticity, your muscles tend to be more excited and tend to remain in a shortened position. And when they are in a shortened position, they tend to get even more shorter over time. And when that happens, that just triggers your spasticity even more. So this is the vicious cycle that you can hear about when they talk about spasticity and contracture or muscle shortening. Okay, so we are going to start off with warm-up exercises for your ankle, your knee and your hip before we start the weight-bearing exercises. I need you to have a towel, and this is going to help you for your ankle and knee and also for your hip. Okay, so if you're not able to get it into a roll, you can get your caregiver or your family member to help you to get this towel into a roll. Okay, so you just want to roll it up like this. Okay, and once you have a roll like this, okay, I'll imagine that this is my weaker leg. Okay, this is the side that I have the injury. So put the roll of towel at the ankle area. Okay, what you want to do is just put your ankle on the roll of towel, sit slightly forward, and when your ankle is slightly bent up because of the roll of towel, I want you to use your stronger hand to push down the ankle and give it some oscillation. Okay. Okay, you can adjust it, put forward. Basically, we just want the ankle to bend upwards a little bit more because most of the time it is going to be bending downwards. Okay, so just give a good push, just a warm up only. Okay, don't need to go too harsh. Just do this for about 1 minute or 2 minutes as you can tolerate. Okay, and then you relax. Okay, then you can go again. What you can do now is you can shift the roll of towel to face vertically. Okay, what you can do then is putting this portion, the outer portion of your ankle. The outer portion of the ankle, you're going to place it on the roll of towel and give it a push down. Okay, this is to help you to turn your ankle slightly outwards. Of course, you may not get a lot of motion in, but it's okay. Just try it and see how much you can get. It's just a warm-up for your ankles. Okay, so put weight from your stronger side. Put the weight through the knee and the ankle down. Yeah, just like that. The next warm-up exercise is for your knee. So you want to get the roll of towel into a long towel like this now, and then just hook it up over your ankle. Okay, hook it up at the front of your ankle. Using a stronger hand, just pull your leg as straight as you can. Okay. For some of you, you may not be able to get your knee straight because you have spasticity and some tightening of the muscles. That's fine. You just want to get it as straight as you can and as comfortably as you can. So this is just a warm-up exercise, okay? So if you're not able to get it as straight as my leg, that's fine, okay? Just do it as straight as you can and as much as your pain allows you to do so. Okay, then you want to try and hold it for about 30 seconds to a minute. If you can hold it longer, that's good, but it will be a bit tiring for your stronger arm as well. So hold it for about 30 seconds to a minute and then just relax. I want you to try this for about 5 times. Okay. Like I mentioned, if you can do a longer duration and if there's no pain, then go ahead and do this for a longer duration. You just want to try and stretch out the muscles at the back of your knee, the hamstring muscles mainly. And also giving your calves a bit of a stretch by pulling your ankle towards you. Okay, so you want to pull. As you pull, if let's say your knee is just like this, that is fine. Okay, that's fine. Just bringing it up like this. And if your knee is bent, right, you can try and use your quadriceps muscles here. This is the front of your thigh, right? You can actually try to activate these muscles here and try to straighten it a bit more as much as you can. But it may be a little bit difficult if you're just starting out these exercises. So now coming to your hip, I want you to get your weaker leg, okay, and then just using a stronger hand, put it over the other leg, other knee here, and using a stronger hand, just push down onto this side. Okay, you just want to do an oscillating kind of a movement. Similarly to your ankle, you want to do this for about a minute or two. And for both the ankle and the hip, you actually can repeat it a few times. Okay, all this warm-up is doing is to just loosen up the muscles and help you to be a little bit more mobile over the leg before you start doing the weight-bearing exercises. Okay, so now we're going to go into weight-bearing exercises for your legs, and when you're spasticity, weight-bearing exercises are going to be very important if you can do it without much pain. Okay, so what's going to happen is I want you to get into a standing position like this. And once you're in a standing position, I suspect how you will be standing. For some of you guys, let's say this is my stronger side and this is my weaker side. And for example, this is how I notice a lot of my patients standing. Most of the time, they'll be holding onto a stick here or holding onto support, and their hand and leg will be like this. Okay, so just by looking at this position, if you fall into a category where you stand like this, I just want you to take note of what is happening here. What is actually happening here is that I am using all of my stronger side. I'm actually putting a lot of weight on the stronger leg and also relying on the stronger arm to support my body into an upright position. And if you can see the ankle, most of the time the feet, it may not be on the floor entirely and the knee might be bent a little bit. If you see a gap from the foot and above, right, if you see a gap that your heel is not touching the floor, that is a sure sign that you are actually activating using your stronger side. So the first thing is very simple. I just want you to get into a proper standing position, and this is going to be a very simple and effective exercise. Okay, so you need to get into a position of standing, but before you do that, if you're not confident to do this and if you feel unsafe to do this, please get a caregiver or a family member to stand on the weaker side, for example on this side for you. And you want to get a support structure where you can hold on to, ideally something that is firm and stuck to the ground or to the wall. So as you're holding on to like this, and if your position is like this, what I want you to do is focus on shifting your weight back to the center. Okay, if you have a mirror, this will be very useful, but if not, then it's okay. You can actually look at some reflections of yourself in the window, things like that, to actually align yourself back to the center. So you just want to come back to the center here. And when you come to the center, you may feel a few things. First, you may not be very confident of your own self. You may not trust your body that is able to hold you up. That is fine. That is why you need a caregiver or family member on this side or therapist on this side. They are the ones who will start this exercise with you. And if you have a bit more strength, then of course you can do this by yourself. But hold on to support and come to the weaker side. Hold it there for about 10 seconds to 30 seconds. Now, what happens is if, let's say you come here and you find that your knee is just giving way, then unfortunately you're not ready for this exercise. This is too dangerous for you to do right now. So if you come to this side and your knee is not buckling down, then you can proceed with the exercise and continue to do a little bit more. And one more thing I forgot to mention is always put a chair behind you, a wheelchair or a chair behind you, so that if, let's say, you're tired, you can just sit back down. Okay, so we're coming to the center, putting equal weight, 50% here, 50% here. In fact, you can put more weight on this side because most of the time you may tend not to put enough weight on your weaker side. So coming here, keeping your knee bent slightly and really activating using your hip and your glute muscles and your quad muscles. Coming here, hold it for about 10 to 30 seconds for a start, and then going here. Going back to this side for a rest, and coming over here 10 to 30 seconds, keep your knee bent, keep your quads and your glutes activated. Hold it there for about 10 to 30 seconds and come back for a rest. You want to do this for about 5 to 10 repetitions for a start, but if you can do more, go ahead and do more, because these are the exercises that's going to get you into standing more better and eventually walking better as well. If you find this video useful so far, do consider liking and subscribing to the channel, and do consider signing up to my weekly newsletter, Rehab Recovery. Now, the next exercise that I want you to do is going to be in a standing position, but you're going to do kind of like a mini squat, but there's going to be a slight variation. So what's going to happen is, this is the weaker side. I want you to take a small step backwards here. Your stronger leg forward, your weaker leg slightly back, and you're holding onto support always. Also having a caregiver or family member on the weaker side. What I want you to do is just bend down a little bit and come back up. Okay, bend down a little bit and come back up. So if you're wondering why the weaker leg is slightly backwards, this is actually to bias your leg, to make sure that you put more weight on your weaker leg. But with that said, this is also a much more dangerous exercise, because this will put more weight on a weaker leg, and if you do not have the strength, you may just buckle down and fall down. So this is why you need a caregiver or a therapist to stand beside you when you're doing this exercise, at least for the start. So come down like this, and really feel your knee bending, your quads activating and your glutes activating, and come back up. Okay, so go down and up. So just a reminder, your weaker leg, you don't have to put a huge step back. Just put it slightly backwards, and your stronger leg slightly forward, and you're good to go by just bending down and straightening. Okay, bending it down and straightening. If this exercise is too easy for you, then you actually can just hold it there for a few seconds, about 2 to 3 seconds for a start, and then come back up. Then I'm sure it's quite tiring for you, and you can do about 10 repetitions for 3 sets. Okay, so the next exercise, what we're going to do is actually one of my favorite. You're going to step on the stronger leg while keeping your weaker leg activated. Okay, so same thing, support structure here, family member or caregiver on your weaker side. What I want you to do is shift your weight to the weaker side. Your stronger leg, step forward and back. Okay, so what is going to happen is, if your leg is very weak, what will happen is that the moment you lift up your leg, your weaker leg is just going to buckle down. Then you're not ready for this exercise yet. You have to focus on strengthening exercises in a seated position or in a lying down position first. So if you're able to tolerate this and step forward, what I want you to do is focus on your knee, keep it slightly bent. You do not want to extend fully, do not want to lock your leg. The moment you lock your leg, this exercise is not going to be effective for you. You're not going to target the proper muscles. So keep it bent, okay? And then step using a stronger leg forward and back. Okay, forward and back. You want to start off with 10 repetitions first, but do it really slowly. A lot of times, people tend to just do it very fast, and you think that you're getting a good workout, but unfortunately, no. You want to put your muscles for a longer period, for longer time under tension, basically. When your muscles are activated for a longer period of time as you're doing exercises, that is where you get the benefit, not from doing quick repetitions. That's not going to be beneficial for you. So once again, come to the weaker side, bend your knee slightly, and step forward and backwards. Okay, step forward and backwards. Do it for 10 repetitions, 3 sets for a start. But if you can do more, go slower and go more repetitions if you can tolerate it. Now, coming to the last exercise, this is actually focusing more on your ankles. And at the start, this exercise might be quite difficult for some of you guys to do, but it's okay, just keep trying. You may get the strength to come back. Okay, so what you're going to do is put a support structure here. If you actually want to hold, for all the exercise, if you want to hold forward like this, is also fine. I'm just showing it in this angle so that you can see my legs better. So what's going to happen is, you want to hold onto a support structure like this, and coming to the center again, like the first exercise, you want to come back to the center here. Okay, and in this position, just push your feet downwards and lift up your body. Okay, just push your feet downwards and lift up your body. So you want to do it slowly. Okay, up and down like this. Okay, you may not be able to go very high at the start, but it is okay. Just push your leg down and keep your knee slightly straight, not fully locked, but straight. Okay, not locked. You want to go up and down, and try this for about 15 to 20 repetitions, and you want to do for 3 sets. If you can do more sets and more repetitions, go ahead and do it. You can consider watching these 2 videos. The one on the left is going to be about ankle spasticity and what exercises you can do, and the one on the right is on the full body exercises that you can do in a seated position. Thank you, and I'll see you in the next video.